Welcome to our presentation on maintaining your health through preventive services. After participating in this presentation, you should be able to explain screenings and vaccines that are recommended for your age, gender, and health history. Although this presentation was intended for in-person discussion, by watching this presentation and taking notes, you should be able to have a list of questions you have for your primary care provider. What does preventive services mean? Preventive care services, or sometimes called health maintenance services, include exams, injections or shots, also known as vaccines, lab tests, and screenings that check to ensure your body is healthy and may discover disease or illness at its earliest and most treatable stage. Specific preventive care is recommended based on your age, your gender, and your health history. These recommendations are based on research studies that indicate which service has the most benefit for people. Please see the reference page at the end of this presentation for more information. Also, at the end of this presentation, you will find my prevention worksheet. As we review these slides together, please make a note on your personal worksheet or any piece of paper that you may have about which screenings or vaccines are recommended for you, what questions you have for your provider, and whether or not you may be due for the screening. This table represents several tests or screenings that are recommended for a number of conditions. We've included definitions in case you're unfamiliar with the condition listed. I won't go through every condition on this slide, but please take time to pause this presentation and review this slide, particularly any condition that you are not familiar with. Your personal checklist is based on your gender, which in this case is represented by gray for all people, blue for those who are identified as male at birth, and pink for those who are identified as female at birth. You will find the age brackets at the top in the black section. So to use this chart, let's imagine that you're a female who is 50 to 64 years of age. From that age category, move down the chart and notice that a female who is 50 to 64 years of age should have their body mass index calculated once a year, should have a mammogram every other year, should have a pap smear to check for cervical cancer, should have, don't yet need a DEXA scan, that's not until 65, and then should have screenings for colorectal cancer, cholesterol, asthma, and diabetes. Use of this chart will depend on the individual. Please write down your questions to ask your provider. Here is a continuation of the same chart. If we stick with a female who is 50 to 64 years of age, then all of these sections that are gray, they apply to both male and female. So hypertension, lung cancer, sexually transmitted diseases, HIV, tuberculosis, depression, sleep disorders, and vaccines for hepatitis B and C, as well as vision and hearing screenings should be considered by the individual. Please take note of this chart and write down any questions you have for your provider. Sometimes people avoid having the tests or screenings done because they're nervous about what it might involve, and for whatever reason are hesitant to ask their provider. We've provided an explanation of what each test involves so you can have basic knowledge of what will be involved for you to have that screening test. Please look at this chart. Again, blue for male, pink for female, gray for everyone, and do bring your list of questions to your provider. Vaccines are recommended based on age. Please take a look at this chart based on your age and see what vaccines you may have recommended for you. Some are only given when we are children, and some are given every year or annually. Please write down any questions that you may have for your provider. COVID-19 vaccine is currently recommended for everyone age 6 years or older. You may find more information on the CDC website. This is a list of resources for more information on preventive screenings and vaccines. An example of my prevention worksheet. On the left, you will list the screening, your question, and whether or not you need to schedule that screening. Thank you for your time.